Hey everyone, welcome to a UK Hangout. We are so excited to have researcher Catherine Nagel here and also Dr. Chris Seenan from the UK, from Scotland. And we are going to do a brainstorming session on what do people with PAD want to know so that we can help put together great resources that would be available to everyone in the UK. What's not out there? What questions are not being answered? That's what we're going to get to the bottom of today. Thank you so much, Catherine and Dr. Seenan, for being us. But I think I'm going to turn it over to Catherine to give a little bit about yourself, Catherine, and where your interest lies and what you hope to accomplish in the next 30 minutes.
Hi. Thank you so much for having me today as well. I'm so excited to be here again. I previously had the fantastic opportunity to work with you guys. I recognize some familiar faces, so it's lovely to see you guys again. I am a doctoral student at Glasgow Caledonian University, and I previously worked on talking to people about what their experience was like with the experience of treatment with peripheral artery disease in the UK. And we're looking to kind of publish that and get that out into the world. But right now, what I'm kind of looking to do is to move towards, okay, amazing, we have these great results. What are we going to do with them? So one of the things we really identified was that people came back and they said, I wish I had more information about PAD. I wish I knew all of these things when I started. I wish I knew X, Y, and Z. It really would have helped me along my journey. So what I kind of thought is that I would love to work with you guys and develop some sort of resource. I'm very open about what, and I really want this to be your guys' ideas. So if you tell me X, Y, if you tell me this, then I'll be like, amazing, we'll see what we could do in that direction. And it's just to create something that's best for you guys, to provide that information, to fill that gap, however you guys think. Really the big question is, what would have made your PAD journey easier? And then how can we kind of work to achieving something that will do that for both yourselves, but also everyone else who is coming after you on this journey.
Fantastic. So we can open it up and just feel free. This is not a raise your hand, we call on you. Just go ahead and jump in. For those that are watching on YouTube, go ahead and add your insight in comments and we'll get to them. And while you're there, just subscribe to our channel for more great information like this. But shameless plug. But I'm wondering if we should start with maybe Guy. You have a few things that maybe you want to share that you might have some ideas for everybody.
Sorry, I was a bit distracted there because I've been doing some video editing today, and my computer's having a bit of a moment because it's a bit overloaded. So I'm trying to recompose myself. You might be better going to somebody else first, and then I'll have a little think.
No worries. Kathy, what about you? Kathy, you always have some brilliant ideas.
Yeah, I'll go first. I would have liked to have known anything at all other than come back when you can't walk and then it will be a case of saving your limb in 2006. So since then, I pretty well just had to go it alone until we all started to get together and until I started working with Chris and Catherine and some of their colleagues. And the thing that sticks out most for me is I was completely blown away to discover the amount of research that's going on in the background about walking with PAD that we knew absolutely nothing about. It is the world's best kept secret. Literally, no one's told us. Just go away and walk, walk, walk. And I said, but how long, how fast, how far, up a hill, down a hill? What? Just go and walk until you can't walk, then rest, then walk. I didn't even get told rest, then walk. And when this happened to me, I was running 10K races. I could walk for miles and miles and miles. The problem only arose if I tried to run. So walk, walk, walk was unhelpful. And it was about at least 11 or 12 years before I found out anything more helpful for that. And since then, it's been a case now all these years on, it's a case of finding what exercise I can do that makes life bearable. because and walking, really being able to walk around my house and walk my sort of minimum number of steps is about the best I'm aiming for now.
Like,
And you know, I think age is a very specific thing in relation to this journey, and it's not really dealt with at all. There's a big difference between a 39-year-old, a 45-year-old woman going through the menopause, a 55-year-old man, a 63-year-old woman, and a 75-year-old woman. There's no way that one size fits all here.
yeah,
And that's
yeah,
not
that's
addressed
probably
at
the issue.
all. That's just generic. And I'm particularly interested in women because, sorry guys, it's just that women take a real huge hit in their 40s with this for a whole lot of reasons, none of which have been properly really explored. And then you're into the, should you take the HRT? Will the HRT help? No one's really looking at that really very well, you know, and women's cardiovascular risk just falls off a cliff at 45.
Yeah.
And that's when you don't realise this damage is already done. And I have never smoked. And then the other thing lurking in the cupboard that's come to light is LPA levels. Nobody ever told me. Apparently they've known for decades that this was a risk, but nobody thought to tell anyone. So I've been guilting myself for the last 30 years about what I should have done to avoid a double bypass at 45. Nothing apparently, just not
You
have the
couldn't have,
parents I had.
no. So when it
That's
comes
my
to the
piece. That's my
walking,
piece.
you bring up a good point, Kathy, about you know, risk factors being number one. So making people, you know, now feel having a list of risk factors, getting beyond the smoking and getting beyond the diabetes, because those are the two things people say, well, and cholesterol and blood pressure. Okay. So we get that. There are a lot of other things that it would be great to make people feel as though they have a better understanding as to why they might have it, and including those additional factors such as age, such as you know, LP little a, such as menopause, that might be an issue with an area that you know, could have notes, right? That the discussion could then happen with their doctor. They could bring in this worksheet, and they could take notes, right, where the doctor talks about with them all of these different potential risk factors and what you can do to mitigate it. Might be helpful. I don't know. What do you think, Kathy?
The point I would make about this is I think it would be a good idea if our GPs were able to take our risk factors more seriously when you have PAD. They're treating me as if I'm in the general population. That's the algorithm that's in NHS Highland. Now, that's positively
Yeah,
dangerous. Really dangerous.
yeah,
Somebody with peripheral vascular disease and a whole whack of other risk factors is not in the general population risk category.
yeah.
And I don't know how far back that filters. Are they treating people in their 40s as the general population if they've got PAD and no cardiovascular disease yet? And I have cardiovascular disease, but most people maybe wouldn't present with that first. So are they just treating them as general population? Telling them it's a long-term chronic condition, just watch what you eat, look after this and that, and you'll be all right, when it's actually quite an aggressive, progressive condition.
And maybe this for all of the folks. Kathy also brought up a second good point in regards to everyone comes in at different levels of walking. And for those that, and I'm seeing more and more of these, who you think are healthy people out walking. Maybe they walk all day at work, and then you tell them to walk, and they're leaving the office thinking, you got to be kidding me. I walk all day, and you're telling me that what I've been already doing hasn't helped. I suddenly have to keep doing that. It's suddenly going to help. And I think that's a huge part of it, that it would be amazing if we could figure out something that could help answer that question for people, or it would help people to make sense of it based on their level, where they're coming in, that they're able to say, I'm, you know, I'm sedentary. Maybe it's a tool, right? An interactive tool that could be embedded into different people's websites. I mean, I would even embed it where it's like, I was just diagnosed, I'm an intermittent claudicant, I've been sedentary, or I've already been walking this much. Or I've been running and I ended up with this. These are my risk factors. Maybe I have a clotting disorder. And then the machine kind of cycles it. The AI algorithm puts it all together and spits out a few of the ideas that have been clinically proven to help people in those conditions or create that walking program that is more customized. Carlo?
Yeah, I mean, I was just going to say a couple of things. I mean, I've had a very strange kind of journey. And even when I speak to the doctors now, they literally don't know. I mean, I've seen like one of the top vascular experts in London, the head of vascular in Kent, and they're like, you've got arterial clots in your leg, and we've got no idea where they come from, and we don't know what's going on. And for more and more, I'm talking to doctors who are like near retirement, and they're like, something doesn't add up here. Why has this happened? Now, I've got high lipoprotein A, it's 270, and my cholesterol is like 8. I've just found out that my 12-year-old daughter's got exactly the same, so 270 and cholesterol of 8, and my eldest has similar. I've just found out, this is all through myself, kind of pushing it, that my mum's is 411 lipoprotein A, and her cholesterol's 8. She's on statins, but she's never been to hospital in her life, whereas I've got arterial clots in my main artery in my stomach and my legs. And because of the lack of kind of information, I've had to, this group has been amazing. Without this group, I've got more information from this group than I have anything through the NHS or anything else, because if you go and Google it, it's not a pretty read, and it's pretty uninformative. Yeah. So like without the information in this group, I don't know where you would look. And even now with my kids, so like we know now they've got 2 risk factors.
Yeah.
If you had the risk factors with me, we know early now, only because I've pushed it. I found my mum's got it. So right, my mum's got it. Surely my kids are going to get it. So my kids are 12 and 15 now. I've got a chance to reduce their risk. I'm having to drive it now and make decisions. I'm already making decisions on my own, because so I'm like, right, low saturated diet, make sure they get exercise, going down the supplement route, speaking to kind of supplement companies, because they have been referred to the Evelina in London, but this has been through kind of my doing. It was only that I was like, I want to get them tested.
Yeah.
So there really is a lack of information,
So I have a question.
knowing what to do. And I mean, for myself, obviously, I found out late, and I was lucky to kind of keep my leg. And I would say it was probably because of this group that I managed to keep my leg. Someone said, why are you messing around? Go to hospital. And I did. And I think that's what literally saved me. But it's just because you go to your local, I went to my local GP for 2-3 years. They told me you're wearing the wrong shoes. You've pulled your calf. See a podiatrist. Do you know what I mean? I feel like maybe they're ill-informed, or they think you're too young, but I don't know. I mean, I really think something has to be done, because even from a financial point of view and a health point of view, that the earlier they catch these things, the less damage it's going to do to people's lives, and the less procedures and that they have to do.
So what do you think about, having, in these groups like this, we have an entire, section of files that Catherine and I have talked about. What if there was a strategic set of files on all of these topics that were driven and written in a way that you guys feel is patient friendly, not talking down to you, but giving you that real information based on the questions you have, that could not only be populating that entire group, but then above and beyond that, those could be resources that would be available for download for other clinics across the UK.
I think having a clear pathway, I think you did do something the other day, didn't you? But it seems like there's a massive gap between the GP. So you go to your GP and they refer you, say, to a vascular specialist, they refer you to someone. That might be 8 months, that might be a year. And in between it, they're like, if it gets worse, call 111. And they say go to the hospital. It's either like, if you don't need the procedure, go to the GP. There's a massive gap in between. That can be, only that I've been on this group, I was like, right, I'm just going to walk, Do you know what I mean? And done my own research, but there's other people, unfortunately, that probably aren't as independent, that will kind of look for answers and will just sit there and wait. And in the meantime, it's doing so much damage to people's lives, unfortunately.
Yeah. That's a
The other
really good
problem
point.
The other problem we've got is the NHS is wonderful, and you know, it's there at the point of real need, but it's a bit of a dinosaur with a brick wall when it comes to patient information that's outside of the NHS verified info. They are not keen. They seem to feel that they'll have the risk attached, but people end up just making their own decisions, or they're prepared to take their own risks. So there has to be a way found to manage patient-led improvement without treating you as if you're, you know, people can be quite rude about it. You know, everybody loves an expert patient. Well, tough shit, because if you hadn't become an expert patient with this, you'd find out a lot sooner that you had something seriously wrong with you. I don't understand it. It's like this control thing, you know,
Yeah,
that you
but
can't
there are
get,
a lot of
you
groups.
know, and that's a serious problem, Kim. It's a serious issue.
Yeah. Well, there are a lot of groups out there that are led by patients that they only are leading to affirm their own journey and their own experience versus actual clinically driven experience. And it can be really dangerous. We have another group out there that sends people to amputations and you know, says it's okay and doesn't question it, and just tells people to walk and don't have a procedure, and you know, if you need an amputation, you need an amputation, and that's not okay. So having, you know, there is a balance there, but not everyone is, you know, you're involved with clinical research, and I think that that's different. That's why I really try with you know, there are a couple groups that you're an admin of that are the more above board you know, ones that it would be great to have actual resources that were official from the UK that, you know, didn't have that liability for them, that could be approved but could
I
still
know.
give the patients the information they need to get started, right? You need a starter pack, a P.A.D. starter pack.
That's a good point.
And I don't
So what
even
would,
have the answer as to why they can't share some of these, because people like Manchester have done this. Is that right, Chris? You know these network of people. There are people who have produced information, help information for their patients. Anywhere where you look on the NHS, oh, my phone's going to run out of charge. Anywhere you look on the NHS, you will find individual hospitals posting up patient help guides, never shared generally by the NHS, but by the particular hospital for their
yeah, that would be
patients.
interesting
But
to
no one's
gather a
joined
bunch of
that
those.
those dots up.
Yeah, I wonder if we could get our hands on some of them. If some of you could maybe post all the ones you find, and maybe we take a look and see what you like, what you don't like about those. And maybe there's a way to create that ultimate guide the GPs could hand out to their patients. That would be something that is a little bit more interactive that you could keep with you
I mean, the Circulation
in
Foundation
your
have
journey.
done some stuff, but it's not really promoted by GPs.
And we have Lynn. Lynn, you've been very patient. Go ahead, and then we'll get to Duncan. Oh, and then Guy has more to say. So Lynn, then Duncan, then Guy.
Okay, so it was interesting, Kathy just brought up the Circulation Foundation, because I actually gave a leaflet to a GP that I last saw from the Circulation Foundation, and also another one, I think it was St Guy's Hospital, and he thanked me for it because he said, oh yeah, quite a lot of people are coming in here with P.A.D now, this will be handy for me, thank you. But I do think I was diagnosed with P.A.D following a private consultation with a vascular consultant in February of 24. He put me immediately on atorvastatin, but that was it. And then it wasn't until I had my stent in my heart in June 24 that I actually had all my lipids taken, and in there was LPA 339 I didn't know what it meant. Underneath it, NHS notes, it said satisfactory, no action.
Oh God.
I didn't even know what it was. When I read up on it, I was
Yeah.
horrified. You know, I do a lot of my own research. I asked them if they would do it again, because there's several typos in my notes, but they said no, it was a one-off. So I got a home kit that was £59. Met with MediCheck, I think, if anybody's interested. So did my own blood test. That came back as 457, which was worse than the 339. So I thought, well, whatever way, this is really high. But I am now on an absolute cocktail of statins, and I'm on ezetimibe, and I'm on bempedoic acid. But my bad cholesterol is hardly moving. In 2 years, it's moved down, not even one. So it's still quite high. I kept bothering my GP for more. What can we do? What can we do? My arms and legs are aching. I have to hang them out of bed at night, so they can't put me on any more statins. They said, oh, your LDL needs to be over 2.6. I said, no, that's not right. Not with not with P.A.D and not with coronary heart disease.
No.
I'm sure it should be under that.
Yeah.
So anyway, in the end, I put all my information, folks, into ChatGPT. Sorry, Chris. Sorry, Catherine. I put it all in, and wow, what a resource that was. And it actually gave me this little speech that I could talk to my doctor. And hey ho, I've been referred to the lipid clinic, you know, but this is 2 years it's taken me to get there. And so it really is worth doing your own research. So where I'm going with this, Kim, apologies, is that I really do think, as a starter point, people need to get their lipids done. That because I'm quite sure that there is a connection between you know, cholesterol and this disease. I know that there's nothing for LP little a yet. You know, I was hoping to be included on the trials, but I didn't manage to get in on time in the end. But I think that's such a strong message. I don't know how other people feel on here, but I really do feel there is a connection, and I really do feel that needs to be right up front there, that people should you know, ask for their lipids, including little LP little a, to be measured.
And that would be a really interesting possible document that could be questions to ask your doctor in you know, based on best practices in the UK, because some hospitals will do the advanced lipid panels and some of them won't. But if you had a resource like this to at least have those discussions with your doctor, I think that would be really helpful. And especially if it's more of a UK official document, if it's something that was put together by a university there, I think that it would be, it would come across and be more credible when you go into the GP that doesn't know it. They would go, oh, this was put together by this university. Oh my gosh, this has to be legit. I probably could learn something from it, right? This patient is not just Dr. Googling or ChatGPTing, like this is real information. These are real questions. You know, hey, did you check the ApoB and LP little a? Did you perform an ABI to rule out, you know, P.A.D, you know, on and on and on. I don't know if that would
definitely the ABI as well. I pushed and pushed. I tell you what, they must hate me down my surgery, but I pushed and pushed to one because I'd got no starting point. You know, I didn't know what my numbers were. Well, so how am I going to know if the walk-in is improving me? How am I going to know if the statins are improving? You know, what it's just a bit silly. It's just a bit ridiculous, really.
Yeah, and that's a big problem. Catherine, what do you think so far? And then we'll get to Duncan and then Guy.
I think this is fantastic. This is exactly like, I really just want to hear what, like, you're also kind of saying, this is what would make it better for me. This is what would make it, this is how it would help. The information really that we're wanting to get at. Yeah, so just like what information would help is exactly what you guys are all sharing with me.
Okay.
Is there any particular way that you guys would want it presented? We've obviously kind of thrown a couple forward, so definitely like user friendly and everything else, but is online or physical best, do we think, is maybe my only other question?
I would say both, and sorry to push in again as well.
Perfect.
What would be really handy would be if they apply the NICE guidelines as well.
Yeah.
So something maybe you could download.
I've had to
Okay.
quote the NICE guidelines. I've had to quote them to the doctor. You know, I've had to tell the doctor, no, you are not right. It's not 2.6. It's, you know, at the moment it's 1.8. I'm way above that. It is not 2.6, you know. But it's just so it creates the bad relationship between the patient and the doctor. You know, I mean, you've got to self-advocate that, as Kathy said, you know, the NHS is fantastic, absolutely fantastic. But my God, sometimes you go into the doctors with a fight on your hands, and you know it. It's like when I went into the doctor last time, I said to him, have you braced yourself? You know, I shouldn't have to say that. Anyway, I'm done.
No, you're great. Keep and don't apologize. We want you to jump in. This is your forum. So maybe
Okay,
something
well, I mean,
that
this
is
conversation has bounced around over so many different topics that I
I
hope
love
can
you, Duncan.
sort of give a bit of an idea on all of them. I mean, I've had actually a great experience with the NHS and how prompt they have been. I was diagnosed 18 months ago, and last October I had a fempot bypass, which subsequently failed, and I then had the graft thrombosed. I had to have a second bypass done, followed by fasciotomy, and then a shin graft, and then an angioplasty at the end of it. So I've been through the wars, but I mean, I go to the gym every day now. I can walk 2 miles, and I feel that the support I've had, both from the GP and from the vascular team in the hospital, has been extremely good, and structured. But I think that the secret to that is really taking ownership yourself, and you've got to get that information and go and push them and have a conversation, and not just accept what you've been told. I was told that when I saw the consultant for the first time, I could walk 800 yards, and he said to me, "You're cured." Right now, this is, you know, I used to go on 8-mile walks and one thing and another. So to be told I was cured at 800 yards was a joke. And I managed to change the consultant. I'm now under somebody else, and I've had a completely different experience from that. As far as, I mean, we have well-man tests and blood tests and well-woman tests in which your cholesterol levels, LDL levels, etc., are measured at least annually. I've managed to be on an inclisiran trial for the last 3 or 4 years, and my cholesterol has gone from 8 down to 2. And I don't know if anybody can get themselves or get this. This is a 6-monthly injection rather than taking a statin tablet. But
interesting.
I mean, either injection, or if you ask your GP about inclisiran, it really seems to make a huge difference to your LDL levels. I don't know if it's readily available yet on the NHS. I suspect it isn't, but it's shortly before, because it has been approved, I think.
I think it is. Sorry. I think it is. They offered me it as well, but some of the hospitals then refer you to your GP.
Right. Well, if you can get
don't
on
know
that
if it's-
disinclisiran, I highly recommend it. It really makes a difference to your cholesterol levels. Moving on to this other stuff we were talking about, it's really important that we have some sort of a PAD exercise structure in the community. And I don't know whether that would be run through local leisure centres or something like this, because it would be really helpful to for people with PAD to meet other people in similar situations. People are embarrassed to go for a walk because they have to end up sitting down on somebody's wall, and then the guy whose wall it is complains because they don't understand the situation they're in. And so to have a sort of group walking or something like that, or a community exercise where people can walk either, because some are very limited ability and others have got great walking ability, and to have then some exercise regimes which people enjoy, because not everybody wants to just walk. What alternatives are there to walking? I mean, in terms of gym exercises or I don't know, stepping or whatever it might be, cycling, for example, that might also help. And to have measurable programs so that people can actually see the progression they're doing, rather than, you know, so that if they are walking every day, that they can see they're getting faster, or they can walk a little bit further, and so forth. And this sort of program, I think, should go out into the community. And there are some good guides as well around. I mean, you were talking about what information is available, certainly from Queen's Medical Centre in Nottingham. I've got some leaflets. I'm happy to post them, which I think are very informative for people who've not heard of PAD before, and then realise, you know, what their journey may be through that. Okay, that's it, I think.
Right. And I
Happy.
think Guy had a couple thoughts too. Guy, go ahead. Oh, you have to unmute.
Hi,
There you
sorry,
go.
can you hear me now?
Yep, we can hear you.
Yeah, so just some points from my perspective, which appears to be quite different than other people's in the group who are at a more sort of serious stage of the disease. So in my experience, the consultants and the GPs, so I've seen one private consultant, one NHS consultant, and my GPs, and none of them seem to be interested at all in you, unless you're at the point that you need surgery, or that you have other vascular problems. And so I've got a 70% blockage in one of my legs, but I mean I've not, between the two consultants and my GP, between the three of them, I've not been given any advice or information of any kind other than to go away and keep walking. So information is really sparse unless you're at that point where you've reached a critical stage where something, you know, intervention is needed.
And I found that this interface between the GP and the specialist is quite difficult. And what I got myself a private ultrasound, and it cost me £90, and they gave a one-page report which I handed to the GP, and I got a vascular referral within 2 weeks.
Wow.
So I would always say, you know, for the sake of you know, less than £100, get yourself an ultrasound done by somebody outside of the NHS, and that report will support you in getting treatment. Yeah,
I mean, I've had an ultrasound. I've had 2 ultrasounds now, but it took me a long time to get to that point. And even when I was diagnosed with PAD through the ultrasounds, that it was literally, there you go then. That's what you got. See ya. But also another thing that's missing, I think, because out of all the risk factors, the only risk factor that I've got is family history, and that's not of PAD itself. It's of vascular disease through my father, but I've got low cholesterol, healthy lifestyle, loads of exercise, eat well. And so for people who haven't got very obvious sort of links as to what might have caused, I mean, I'm still at a loss as to why I've even got this, really.
And that could be interesting, Guy. We find that here as well. Something that could help patients with the risk factors and helping their doctor get to the bottom of it. Because usually when we find that people have a history, there is some other genetic factor, for example, an MTHFR mutation, where your body has trouble turning food into fuel. And even the American Heart Association here has acknowledged that a lot of these patients that you can't find a general risk factor might have this mutation. And it literally is like when you're not processing, and Guy, if you can put it on mute for a second. But it's your body's not turning food into fuel, so your vitamins aren't being absorbed properly, and so your homocysteine level is an enzyme in your blood goes up, and it's like nails on your artery walls. Well, if you don't have any other explanation, that could be a direction. And so having these types of things to walk you through what the risk factors are, and if you can't, if it's not X, if it's not Y, and it's not all of the above, then what else can you ask your doctor to check for? Clotting disorders, an MTHFR mutation, et cetera, et cetera, et cetera. So you can at least get the answers. And I think that that's a big thing that I hear from everybody is, what is the reason I have it? And to help the patients help their doctors explore a little bit further, could it be Lp(a) that has led to it? So I don't know if that could be allowed or if the NHS would approve something like that, but I think it would be very helpful.
That would be amazing, because there also seems to be a lack of sort of the holistic view of it. And also, I don't know about anybody else, but I've encountered things. I find I get chronic fatigue on occasion. It's not every day; it just happens every now and again. But I'm convinced that it's some sort of secondary symptom of P.A.D. But I've asked the consultants, and they're like, "No, it's nothing to do with it." But as of yet, I've still not managed to get to the bottom of whether that is a possible secondary thing with P.A.D. Nobody's been able to tell me. And then also you've got things like mental health never covered, coping mechanisms for just for anybody who has to deal with a chronic illness, sort of how you keep on sort of getting through it on a day-to-day basis. Then there's like sort of practical things like what sort of things should I look for in my footwear when I'm exercising. Again, things with the lipoprotein A. Like I'm 18 months into sort of finding out about this disease now, but I've only just found out about this lipoprotein A, so I'm going for a blood test for that. But again, up front, it would have been good to have known that from the consultant or the GP. It's only one of the nurses who happened to mention it.
Wow.
Guy, excuse me, I just say, have you, I was really, really tired as well. I'd convinced myself that it may have been one of the side symptoms of P.A.D. But I've actually now had a recent blood test that found out that I was severely low in vitamin D. So
Right.
so that may be worth checking that out. And since I've been on the vitamin D, I feel so much better. I'm on, I don't know, I had like a 4,000 something loading dose for a month, and then I'm on 2,000. It's not milligrams, it's something like IU, but I feel much better with that. So that may well be worth checking out.
Thank you. I'll look into that. Also, I don't know if anybody else is. Sorry, you just made me think of something else. So this is a bit off topic, I'm afraid.
Sure.
Does anybody else also suffer from like? Because I swear, sort of, I've got, for want of a better word, muscle wastage in the tops of my legs and my buttocks and stuff. I'm convinced that's sort of related as well. But
Yeah, it is
Well,
related.
it will
And
be,
that's
because
where,
if there's,
It is related.
yeah,
Right.
see,
I mean,
and
if your
that's
blood
something that we
supply is
really, no one
restricted,
talks about.
then
Catherine and Dr. Seenan. No one talks about that stuff and how to
Yeah.
fix it. And that's a huge problem. We see it all the time, and doctors don't even know about it. They're like, they look at your legs and one's small, thinner than the other, and they're like, well, just the way it is, no explanation for it, and there's nothing you can do about it. But there is something you can do about it. So that could be, I know that you're working on some good stuff ahead, but that is interesting. I don't know. We have it where people tell us it's because of the cholesterol drugs, and then others just general lack of treatment for the poor circulation in a timely manner. So a lot of things can factor in, but yes, Guy, that's a huge issue. And that would be, if that could and should be a part of any educational materials, of something to watch out for.
What
because it
sort
is
of
a
things
reality.
can help with that then, Kim? Sorry.
Yeah. And that's something I think, Dr. Seenan, if you want to weigh in on this, that I think you've been studying, or you're looking to study ways in which even doing some weight training or resistance training might be helpful.
Yeah, I mean, if you think of why it's happening in the first place, it's it's the lack of, or the reduction in blood supply to the muscle, and also therefore nutrients, and it can also affect the especially if you have diabetes as well, there can be an effect on the way the nerve signals reach the muscles, and all of these things can cause what you're describing, and what we would call this kind of atrophy of a muscle, and it's when the bulk of muscle reduces. So yes, generally, the solution often is training of some sort of kind, and that training can be through walking, but yes, absolutely, weight training. The key principle is that you need to what we call overload the muscle, to cause it to build back and react, and build back some strength and some bulk. But it would be depending on the muscle and the nature of your individual, the prescription of the overload would be different.
Yeah. I think that's a very important point, Chris, because we see this, you need to walk, you need to walk, you need to walk, but actually you can walk your socks off, you'll still atrophy in the glutes and quads if you can't walk fast enough, up enough hills fast enough. Whereas getting on the bike as well as walking, going to the gym, doing resistance, doing squats, lunges, all these things that really work your quads and your glutes will help to counteract that. And that's a message that doesn't really get over. It's lost in that you can only walk. It's not, you have to do more than walk. You have to, apart from the fact you'll lose your mind, you have to keep those other muscles going.
And what
do you
about
need to
even...
do you need to eat more protein to counteract it as well, than you would normally?
That can certainly help, and that all comes down into that principle of kind of training and building strength and conditioning of your muscles. You don't have to eat more protein, but it can help when you are training to help kind of add that muscle bulk. But it is quite, it's a bit more nuanced, I guess. I don't want to kind of say general things here.
Yeah. Sure.
So what do you think, everyone, about, I mean, we always keep coming back to the walking, and that is something that is a specialty of, in Scotland, and they're leading the way in terms of research. What if there was a downloadable brochure that was a walking starter kit based on the research that you guys have done there in Scotland, the publications that you've put out, the tools that would be helpful to improve your walking, which may include the TENS devices, right? Maybe a few dietary things that might help improve your situation with muscle waste. So, increasing your protein. And it could be just simple things. You don't want it to be overwhelming, but I think that it could be as simple, as just a how-to guide that can get you started with your walking program.
I was just going to say, if you don't mind, one of the things that I would suggest is, so for instance, I can walk like an hour, right? And then I just get a bit kind of like, my feet start going, I lose posture basically, and then I have to sit down. So I was like, right, what can I do so I can work cardiovascularly, so I can get my heart pumping, Yeah, because I can't, by walking, it will raise my heart rate, but it's not keeping me doing it. So the only thing I've found that I've managed to be able to do is I can go on the crosser and do 40 minutes, burn 400 calories, get in the right place, you know, making my heart do. Because if I run, I can run about a minute and then that's it. I'll get claudication. Do you know what I mean? I can't do it. Whereas I do think the crosser is the one. My leg goes a bit numb after about 20 minutes, but I still continue to do it. Yeah. I do think for people that you got to get your heart working as well as your legs. And I think it's hard to do that by just walking sometimes, especially maybe if you're, say, a little bit younger. Do you know what I mean? I think to find something else, walking 100%, I still get my steps in, but I do think being able to work cardiovascularly, it's a must, because at the end of the day, heart's a muscle, it's pumping your blood. You have to find a way, if possible, to work cardiovascularly as well as just getting the steps in, I think. Yeah. So I would recommend the crosser for people if you can get access to a gym and maybe you can't walk, you can't run, but you can walk. Try the crosser, because I can't run, but that's the way that I found I can do like a 40-minute session and get a proper cardiovascular workout, which I can't do via running.
Yeah.
Okay. I'm starting this little thing over on the side, just wondering, I'm gonna, just what are the elements? If you would want like a how to walk starter pack brochure that could be downloadable, it could be uploaded into groups, it could be shared through the GPs for every patient that gets diagnosed with P.A.D while they're waiting for a vascular consult, if they're in the intermittent to lifestyle intermittent to lifestyle limiting claudication stage. What are some of the elements? Do you guys like this idea to have some sort of a starter pack based on all of their research? Would that be helpful? Things that have an explanation of the collateral vessels, how they work, why pushing through the pain is important, three different levels to start and how to vary your program based on where you're starting, the tools to help improve your walking distance, whether it's the TENS device or walking sticks, ways to improve muscle waste, which would include a few resistance training exercises that you could even do at home. What are your thoughts? I see Fiona, you haven't spoken up, but I see you nodding your head. Do you want to participate and share?
Yes, I'm at, thank you, Kim. Very interesting discussion for me. I'm at quite an early stage, having been diagnosed a few months ago. Like some others, I've never been given any reason as to why. I'm not overweight, I'm not diabetic, I've never been a smoker. However, I do have something called polymyalgia rheumatica, where I was diagnosed 3 years ago. So far, nobody has been able to tell me that there's a relationship between the two. I do believe there is, and I'm sure that's contributed to my peripheral artery disease. I have a complete blockage of my popliteal artery on my right leg.
Behind your knee.
They've now told me that on my left, that there's something going on. They don't understand what. They think that the artery has split. It's a dissection. And they basically told me they thought about offering me some surgery, but have decided against it. And I quote from my vascular surgeon, he said, "It doesn't seem a good use of your time to come into clinic to discuss." So I've been, I'm in Edinburgh, by the way, you've probably recognised the Scottish accent, another one. I'm very frustrated by this. And in fact, I was going to approach you, Kim, to find out if there is somebody else I should be speaking to in Scotland or Edinburgh, and I will do that separately. This isn't the place for it. I've learned, again, like others, so much through the group, and today has been a good learning opportunity for me too. LPA little a, LP little a, I'd never heard of before. I'd not had lipids checked as far as I'm aware. I'm on warfarin. I got put on warfarin, so I take that, and I was also put on rosuvastatin. But that's as far as I've got with it. The advice to me has been to walk, and as I say, I'm very frustrated by my vascular surgeon by saying there's no plan to go forward. There's no, we'll review you, we'll do something for you, keep coming in, keep in touch, just nothing, just out to grass. So I'm a bit disappointed in the whole process, I have to say.
Yeah, and I think that Dr. Sinan and Catherine, if you decide to move forward with something, you know, a brochure or starter pack, it would be, we get to ask this a lot, where are the areas that are best for collateral vessel growth? And the blockage behind the knee, that's just a revolving door waiting to happen with procedures. That's just not going to stay open no matter what. But you have the ability to grow so many. When I hear people say they have a blockage behind their knee, I'm like, thank God, because that is a great spot for you to grow collateral vessels. And having an explanation like that, that would be really helpful for people. And it would be encouraging that you can do this, especially for people with a knee blockage, you know, such as that. In terms of your other one, that's always tougher. There's so many different presentations of disease, and that could be even something that might make you feel comfortable to have explained somewhere in one of these brochures, to just have a statement that says, hey, you have to realize that every one of you might have a unique presentation. You all have your own risk factors. You need to, it's important to go at your own pace, right? And to keep asking those questions of your doctor and getting the second opinion, which you do have a right to. It's just there are different ways in which you have to go about it depending on where you are in the NHS. But that could even be something that could be helpful to be in there, right?
Thank you.
And I'm definitely happy to talk, but they might have walking programs that they know of in your specific area, and might be able to offer some advice on how to get involved. And that's also something would be really helpful for the NHS and could inspire more
I have
areas.
actually, sorry, I have actually asked about a community walking program and was told, I'm sorry, we don't know anything about this. So that's something that would be useful to know as well.
Yeah, just even the supervised exercise therapy programs.
Yeah.
To have a list of those to, or maybe there could be a communal resource in the NHS that you could put together where people know where those supervised exercise therapy programs, whether they're in facility or remote, are available and how to ask for them. So I know you guys have a lot more there than we do even here. So that would be great. Oh, Kathy and then Guy.
I just want to make a couple of points. The LPA connection, we're increasingly seeing, and I think Lynn would agree with me, that patients who turn up on the P.A.D board or on the LPA group, there seems to be a common factor. I don't have high cholesterol. That's why I wasn't even given a statin after I had my double heart bypass in '96. They refused me a statin because my cholesterol was not high enough. It was deemed to be low at 4.2. I've never had high cholesterol. The only time it went up was when I had the heart attack. Then, of course, I had to go on the statin. And in the 26 years since the heart attack, I haven't had another heart attack. So I think the thing to think about statins is they're doing a double thing here. They're calming down the state of the plaques in the arteries. Even if your levels never move, they're actually doing that other thing. And a lot of people don't understand that's one of the things that it does, which, you know, against the risks might be helpful. That's one thing to say. The other thing to say is people's blockages impact on them in different ways. And I've been 30 years with this business. I could climb stairs to Britain. I mean, I have climbed the stairs in the Arc de Triomphe with P.A.D. I could climb stairs because even with 100% blockage, in my left SFA, I had great quads and glutes. I can't walk. I couldn't walk the same distance that I climbed stairs. I can still go up hills with no pain in my calves. And I used to be able to go up hills with no pain in my glutes. But now as the disease is progressing, I'm getting pain in my glutes. But I'm pain-free in the calf. And what's now happening is if I go up a hill, I get a double dunt on the return pain. The return pain hits the glutes first, and then there's a delay when it feels for all the world like a labour contraction. That is what this pain is like. You know it's coming, it builds, it hurts, it subsides, go again. And that pain has got much worse over the years. So the quicker the return is, the easier the pain. And the idea is to shorten that return. This is very personalised for people and isn't going to really be, you have to figure it out for yourself. You have to go climb stairs or do your Nordic walker or get on the bike. I had no pain on the bike, pain-free on the bike. until it started to develop, the disease developed. Then I had to change bikes for a carbon frame, pain-free again. Now I've changed to an electric, pain-free unless I've got to walk with the thing. So, you know, there are exercises you can do that will give you cardiovascular health, make you feel good, that won't impact on your blockages. And they're good as supplementary exercises. They will also build strength. But your walking is personal to you. You know the distance you can walk. You can measure it, and whether you can walk to put your rubbish bin out, whether you can walk around to put your neighbour's rubbish bin out, whether you can walk to the shops. You know that how long it takes you to go up your own stairs or upstairs at work. And these are things you need to pay a lot of attention to. This individual thing, you need to time it, you need to check it, you need to make it your benchmark. Like Lynn was saying, how do I know if I'm improving? Well, if you're improving, Chris would say you're improving if you can walk the same distance. I would say you were improving if you can walk it slightly quicker or with less pain or less return pain. And those are the goals that I think people need to aim for. If we're waiting for the NHS to tell us this, we're going to be waiting until I'm dead and gone long, because it isn't going to be that personalised. And that's something that we can help ourselves with. We can share that experience to tell people, like Mike and his line dancing, what works, how good he feels not giving his line dancing up. Because it's great to be able to do something that you get involved in that you don't really notice the pain so much because you have to keep doing it. And walking isn't that thing. Walking is really hard. And to push yourself through that pain is incredibly difficult. And I think there's a lack of empathy when it comes to that. You know, that actually this is real pain. And you're talking to someone that's had 4 natural childbirths, a heart bypass, a heart attack, dental implants, and 3 nosebleeds that have had to be packed. This is pain.
Awesome. And Guy?
I just remembered I wanted to go back to reiterate actually what Duncan said about it would be really useful if there was some sort of way of finding out if there's other people in your area who've got PAD that you might be able to walk with, and to be able to sort of almost like a dating matching profile, like, you know, you can match with people at intermediate stage or that have only just got it or more severe, and try and find somebody that's got a similar sort of walking pace to you, that you can walk with.
Yeah.
I know that's a massively
The only thing is
complicated
there has
thing
to
do.
be a formal program for
Yeah.
those, because there's a huge liability
Yeah,
for
of
anything
course.
started by the NHS. I've talked to a couple folks. So it's something that Dr. Seenan is working on, I think, with research to see if it would even be beneficial and see how to pair people up. Because if you're at, let's say, a more advanced stage than someone you get along with and have the best conversations with, is it really doing that friend any good with their program if they're walking slower for you and stopping for you? You're getting the benefit, but are they? And so that's something that they have to consider. But I know that Dr. Seenan, that is something that you guys are working on. And it's also something that I'm hoping to work on with you guys with the app. So maybe there's a way that remotely you can find people in your area to walk with, even if it's just someone you can talk to via the phone that's in your area. So you can stop and walk as much as you want. But those are great suggestions, and still having the supervised programs, the community programs, and creating a resource where those are available, right, would be really, really helpful, because I think they're more prevalent than it is out there. Duncan, go ahead.
Yeah, I was just to pick up on what Guy was saying. We have in our local council-run leisure centre, there are various groups that I suppose are people come with a letter from the GP, from the surgery, and would join, not for PAD, but for other things that, and I don't see why you couldn't have something similar that could be just led by by somebody within the group, or it could be led by somebody who's got some P.A.D experience or whatever. And it primarily would allow people within that environment to meet people with similar problems to them, and to have that sort of informal chat. And then they can position themselves. They can see how they're doing relative to other people, and that they're not alone in this. You know, so I think that's something that, in a way, needs to be initiated from your local surgery.
And some of these supervised exercise therapy programs, maybe it doesn't have to be formal. Maybe it could be something that's a little bit more, you know, or less structured, cost less, be less time intensive for people, but allows them, you know, the just a place people could go each week for accountability and friendship and camaraderie, you know.
Yeah.
Okay,
Sure.
so that could really
And
help.
it would help with
Hi,
people's
Mike.
mental health as well. Hi.
And mental health.
Sorry.
Yeah. Hi.
Yeah, just
Maybe we could
just
all
just
sign
touching
everyone
on
up to
what
go
Guy
line
was.
dancing with you.
Yeah, it's a lot of fun. It just it takes my mind off it, to be honest. But I'm just gonna just mention what Guy was talking about earlier about people's mental health and walking group and stuff. It'd help with the mental health of the aspects of P.A.D. I got diagnosed in February last year, so I'm coming up to what 14, 15 months now, and I still struggle. I'm still struggling. You know, I do enjoy doing my line dancing. I do enjoy going out for walks. I enjoy getting on my treadmill in the mornings. I mean, it's spring here and it's still snowing, but you know,
Yep, I love it.
it still messes with my mind a
But
lot.
something that really
And
helped you, Mike, you ended up getting something from the NHS when you were diagnosed, and they realized you couldn't do the separate supervised exercise therapy program. What was it about the information that you ended up getting that was really helpful? There were some simple exercises that you could do to improve the circulation, even while you were sitting or while you were standing at the counter and such, I think.
Yeah, it was. I mean, people that have been on the supervised exercise therapy, they'll know the list of the exercises that they give you, like heel raises and standing up from a chair and sitting back down, standing up, sitting back down, doing squats and lunges, like Kathy said, walking up and down the stairs, one step up, one step down, and there's a lot of different things that you can do. I kind of did all that for the 12 weeks, but then created my own little workout. I have started doing running intervals now on the treadmill as well, which is helping with it. Yeah. Sorry, I'm struggling with my own mind. So
Another
Yeah,
feeling.
that's really and so, Lynn, and then we'll go back to Catherine to see what other questions she has.
Okay,
Go ahead, Lynn.
I just wanted to say about walking or finding a friend. So I'm on the UK P.A.D group as well, and when I was first diagnosed with this, I felt so isolated and so on my own, even though the group was really helpful, both the American group and the UK group. And I actually reached out and I said, is there anybody else in Buckinghamshire where I live that has P.A.D? And a lady answered me, and then we went private, and I actually see her every 3 months. We meet up and we just talk about you know, how our disease has progressed or if there's any changes. I find that really helpful, because we're both about the same age and we've both experienced the same things, apart from the fact that I've had the little heart op and she hasn't, but that was really helpful. So I mean, I think you've got to be careful, because you don't want to attract,
That's the part.
well, I'm not going to say what I want to say, but you know, people that are maybe would be wanting to meet you for different reasons. Mind you, with my profile picture now, they'd be crazy to do that. But the other thing as well is the way I count my steps is I use Pacer, which is on my Apple phone. And within Pacer, they have all these sort of challenges that you can do. And some of them you can do for free and some of them you have to pay for. I remember last year I did, I think it was walk the length of the River Seine, and it tells you where you are. There were like about 38,000 people that were doing it, and I was really pleased because I was about 500 in that lot, you know. It really kept me going to try and keep my place in you know, it was really good fun. So it would be great if there was something for the PAD community like that, you know, where we could all, definitely for me, that would keep me going. I'd be thinking, you know, oh, where's Mike? You know, is he beating me? And where's Kathy on that? You know, that would be really great, I think, to have. I mean, I'm not technical minded at all, so I haven't the foggiest how you would do it. But you could probably do it within the Pacer app. I don't know how you would do it, or something very similar to that. I think would be, I know not everybody's got access to mobile phones and apps and things like that, but I would find something like that really, really helpful.
It is always helpful, maybe a list of favorite apps and such that people use with
Yeah,
that
Strava
could
is
help with
free
your walk.
and it can do
Yeah.
that.
And they're a bunch, and everyone's their own person. Everyone has, you know, something different that they want out of a tool or something that's going to help, whether it's music or just talking on the phone. What's going to motivate you? Maybe there's a section in the brochures how to find something that is going to motivate you, whether it's, you know, choosing an app that'll gamify, finding a friend that you can walk with even via phone, or another app that gamifies your walk, and putting those maybe into a thing that someone go, oh, I didn't really think about that as being something that could help with my progress. But I want to get back and make sure that we're looking at resources for education, and that's really what Catherine is looking for to help. What are the resources that you think could help better educate people with PAD, and in what form that you want them to be available? And so far, what it seems like is it's something that would be available online, and something that you could hold on by hand, but maybe it's something that's downloadable from online onto your desktop, onto your phone. It could be just a web-based app that could be just transferred onto your phone for easy access, whatever it might be, but easily downloadable no matter what onto your phone, but something that could be available as a resource to GPs across the US to give patients some sort of starter pack. I'm thinking that's what I'm kind of getting from people. But Carlo, before we get back to Catherine, what other insights do you
So
have?
I was just getting attacked by my cat. He was just coming to say hello. Now, all I was going to say, I mean, one thing about the NHS that I've found really strange is that, and it does come down to the information as well, it does kind of link on, is whether you're seeing a lipids clinic, whether you're going to see vascular, whether you're seeing your GP, they all just seem really not aligned with each other. I think the communication, like if you're like, right, okay, you've got PAD, and they send you to someone, they were like an expert just on PAD, I think it would solve so much, because what you also end up doing is every time you see one of these expert specialist doctors, that you're just kind of repeating yourself over and over again, and you just feel like they don't know any of the information. I mean, like, so it's all very well, even if you can make the information or make it available. Like, I think if the first person you saw, you know, so if you go to a GP or you go see a vascular, say, right, you got PAD. I think if you were dealing with someone that generally deals with PAD most of the time, it would be much kind of easier, because everybody I've seen, like, if you go see a lipid specialist, they don't just deal with PAD. It's like, you just seem like you're on a different journey every time, where you kind of like your goal is to kind of obviously prolong or improve what you've already got. And I just feel like every time you go see a different doctor or whatever, you're repeating yourself, and it's like they're not working like together, basically. I do think that is one of the issues that we have.
Yeah, but strangely enough, that doesn't happen with cardiovascular disease. It's completely organised from cardiologist to surgeon back to interventional cardiologist.
I mean, I
So-
find it absolutely crazy that, like, I don't know anyone that's got PAD. And when I speak to people that are even know about loads of other illnesses, it's like it didn't exist until I found out that I had it. If that makes any sense. Like, I
Yeah,
mean, you
well,
guys do a
more
great
than
job. I find it mind-boggling. And I, even myself, before I was like, "What's that?" If you Google it, I do find it's something that affects so many people. It is just unbelievable that
it's
it's just
you're not
so well
alone,
known.
because
It's
they just came
crazy.
out with a study here in the US, Carlo. It showed that 8 in 9 general practitioners here don't even think PAD when people come in with leg symptoms. They think everything else. So 5 in 6 patients with PAD here in the US alone are not getting diagnosed with PAD upon their first presentation of textbook symptoms. So it's a
100%.
grander, more systemic problem. And I think that, you know, efforts like this are going to be very helpful in getting the information out there, which is why I think that even providing great tools that we can, you know, share in these Facebook groups, where people are going to first in a lot of cases with their symptoms that people are ignoring, you know, pushing those out there in these groups so that patients with it can help push those out even further. I think that could be really helpful, and especially something that has to do with walking, that is the best medicine for it, and something people can do, um, would be a great start. I don't know, what does everyone think? I don't know. Catherine, what are your thoughts? What have you come to the conclusion of so far in listening to everyone?
That was absolutely fantastic. Thank you so much. I don't know if you noticed, I was writing a bit of notes, but I'll definitely go back and rewatch. This has been so helpful. I've got loads of ideas of things to try out and see kind of, I think you're absolutely on the right track there with like a starter pack, something downloadable, something that's accessible both on and offline in some way, even if that's via sort of printing. Yeah, I think that sounds amazing. I'd love to come back to you guys with something a little bit more finished on that if you guys are happy enough to do that.
Yeah.
But yeah, no, that was absolutely fantastic. Thank you so much. I've got no more questions. You guys have been really, really amazing.
And if anyone wants, if you want to, I don't know if you have the ability, if you want to put your emails in there, I don't know if all of you get the notifications and the calendar invites, but I'm happy to, or you can just message me or email me info@padhelp.org. I can put it in here, and you can just message me. I can get you on the calendar invites for all of these, so you don't miss it when she comes back with, you know, some options based on the conversation that you guys had here today. It's always fun to see what your insight, the experiences that you share create, and the influence that you've had. So happy to do that. info@padhelp.org. Meantime, we're going to end the YouTube broadcast. If you want to join the future discussions, go ahead and email that same email, info@padhelp.org, and we'll get you on the email list as well if you're watching via YouTube or Facebook or Twitter right now. Just go ahead and reach out. But thanks everyone for joining us. We really appreciate you. This was a really productive discussion, and it is available to rewatch. Just go to youtube.com/the way to my heart, and you'll be able to hit replay. Thanks everyone for joining us.
Thank you.